All right, it is Monday. We want to welcome you into Coronavirus Inside the Arizona Numbers, where we take a closer look at the numbers coming out of our home state right here, but this information can be applied to wherever you're watching from. We love to see in the comments where you're watching from, where you're joining us from. Spending a bit of your afternoon, we're going to dive right in because we have lots to talk about from over the weekend. One of the first things, Garrett, I want to talk about is a quick headline that we have had the first confirmed case now of reinfection. And so that's a conversation about how long immunity lasts, whether for some people it just lasts a few months or others might have protection longer. That just coming out today. And of course, a lot of people going back to school again on this Monday. And then there were massive Zoom outages today. So the struggle with that continues as well, and U of A is back in school. We'll talk about some of the numbers specifically coming out of U of A. They are releasing a bit of information from there. As we said, ASU at this point is not, but we'll talk about all that. Welcome to all of you. I'm seeing all these familiar cities here in Arizona, so thanks for taking time. Garrett, let's get right to the summary page. The news we can at least celebrate today is that there were no, the death number did not change on the summary page there.
Yes, correct. So this is what we have. We have some, and this is weekend reporting, of course. You know, these numbers are always significantly lower on weekends. Although, as you say, as we talk about how these average out, we have been much lower lately. We have 311 new cases reported yesterday, lowest reported cases in quite some time. And then actually this whole weekend actually had a whole bunch of low reported cases. Now that I think about it, I think yesterday was actually 208 cases yesterday. So basically today and yesterday, only less than 600 cases in between the 2 days. And that hasn't happened since, well, I guess on one day, on August 10th, it actually happened for 1 day. But essentially 2 days, very low reportings. 0 deaths, a bunch of PCR tests, 6,300 PCR tests, 1,200 serology tests. Our percent positive was in was under 5%. For every single metric, whether it's the Johns Hopkins, whether it's the Epi curve, or whether it's all cases, they were all under 5% today.
That's much better news than we have seen recently. When we look at just Maricopa County in particular, it makes up 175 of the more than 300 cases today. So as always, it's the most populous county and it has the biggest bulk. How many actual test results did we get in here in Maricopa County?
2594. So that's it appears a little less than half of the results actually came from Maricopa County. Yeah. Which is interesting, and I think that has a lot to do with there was a pretty big testing going on at University of Arizona, and so I think a lot of the testing came from Pima today. As you can see, 670 cases yesterday, or tests from yesterday. So not a whole lot of tests out of Pima, a decent amount, but not a whole lot. So, you know, we'll have to look through to see where we can find where these tests came from when we look at this. But, you know, still a really good number for Maricopa.
Yeah. Let's dive into U of A specifically. We were talking last week, so many of you are parents or grandparents on here, and you were asking about the numbers coming out of the universities. And we're happy to report that U of A is reporting their numbers, and their numbers are actually quite low, which is very good news. But they've also set up a specific dashboard for this so that parents or grandparents or curious students are able to look at that. Garrett, do you possibly have that up so we could peek at it?
I do. It's more of a kind of a bullet point rather than a dashboard, but it's still here. This is on covid19.arizona.edu/updates is where you find this. And right here, it gives your COVID-19 testing results. And you can see between July 31st and August 23rd yesterday, the college conducted 8,300 tests and only 27 positives. That is a less than 1% for the school, which is fantastic. I mean, I know that this is one of the biggest concerns people have had was the schools going back, people going back to school, but that's a very good result.
Yeah, great news. And it's great that they're allowing this information out there. Of course, the information is always reported to the state, but they don't necessarily have to tell the community how the numbers look. But boy, with numbers like this is great news. Tina's asking, is this U of A or ASU? Tina, this in particular is U of A, and we'll get the address up on the screen so it's easy to find. For ASU, they are not at this point releasing their specific data to the public. Of course, they are, again, turning it over to the state, but they're not setting up like a dashboard or a website like this to keep us updated. We can tell you that there is some enforcement and education going on around ASU as it pertains to getting together in large groups. In fact, Tempe put out 9 party citations, Tempe PD, over the weekend. 6 of those were related to students. This is all really about education rather than enforcement. They do have to put some enforcement out there for the loud parties, the drinking, or things like that, underage drinking. But this is about also informing these groups as well about the risks that are out there. We also had some interesting numbers, Garrett, coming out of Pinal County. They added some more specific numbers as well. And we'd like to highlight these places just because we're being so forthcoming about all the information that's coming out. That helps all of you make better decisions. And I see a lot of comments here about, more fear, more fear. This is not about fear. This is about the numbers here. We're on here to help you better understand the numbers, because these websites can sometimes be convoluted. Sometimes it's hard to find the information in there, and we're just taking the time on here to show you where the data is, show you where the numbers are. You can make decisions about your life and your family. I'll make decisions about my family and my life. You know their health best, and I know this crew's health best, but we're helping you find these numbers. So in the comments, let us know what you're looking for, and we'll help you find those numbers, that information. So in Pinal County, what have they added for us?
So thank you. You found the county I was looking for. So it was Pinal County that definitely had a large batch of tests drop. This leads me to believe that these tests came from the Department of Corrections, only because the majority of testing, anytime batch testing does come from Pinal County, it does typically come from the state prison complex down there. As you can imagine, there's not much else in Pinal County. There's Santan, but those are just communities. We expect community testing. That 2,000, that comes with that today, their percent positive for Pinal was 1%. So very good drop as far as for Pinal County, 2,000 tests, only 24 cases reported off that.
Yeah, that's some really good information out of that area. We had a request for Gilbert, and I'm seeing some people posting your cities and requests for school districts. Now, keep in mind, the information that's come out for school districts is updated every Thursday. So that information helps you better understand what areas are clear to open schools. Obviously, school districts are making their own decisions on this, but the metrics that the state set forth, that's what we talked about on Thursday, but we're happy to highlight some of those numbers as well for you. And there's 2 different things, Garrett, that we get numbers for. First of all, we get just the county look at the school district, so an overall snapshot, and then another site that breaks it down in Maricopa County, and that is zip code by zip code, school district by school district. You get a better idea of each neighborhood, but that doesn't come out until late on Thursday afternoons.
Yes, I can share it, of course, and we can talk about it. But yeah, we don't have any updates on it. We only get updates once a week on that dashboard. Yeah. But we can absolutely look at it. I'll start at the city level, just so everyone kind of gets the general idea. As you can see, most of the East Valley cities, with the exception of Mesa, these cities are already considered moderate based on the spread or the numbers that they have in those cities, as well as Peoria. You do have a little bit down here at Litchfield Park is also moderate. But aside from that, the big ones, Phoenix, Glendale, Tullison, Goodyear, Buckeye, Mesa, all of these are still considered significant spread. We do have Paradise Valley here that is already considered minimal. As we all know, Paradise Valley, very wealthy area of the district, very low population density. So nothing to be unexpected in that portion of the valley.
And we can sort of see this line of yellow, and it's, what about Scottsdale Road? That is is cutting right through there.
Yeah, you can sort of see It really, in fact, you can see it really does split at Scottsdale Road when we come back down closer, because that's where the city line is. So you can see right there is sort of the split until you get to the East Valley, and then it splits at the Tempe city line, because it's Tempe, obviously, that has it. But essentially, it's the split, and you can kind of see it all over the place. If you go to the zip codes, you almost see the same thing to an extent. You see it's, even though it's a little pressed a little more west, it's still, there's very much a dividing line right here in the zip codes, where the majority of the zip codes on the east side of the valley are considered moderates, and the majority on the west side are considered the substantial spread.
Yeah, so we'll continue to watch this. Again, we'll spend more time on this as it's updated for us, and it's updated later in the day on Thursday. So most likely we'll go over this even more on Friday, but I wanted to make sure all of you on here know where you can find that. The address is posted right there on the page. But let's talk about some really good news coming out of this R0 number. It's lower today, not totally unexpected, as you said, Garrett. We did see we were very, very low. We saw a slight bump in the number, and that could have been, as you mentioned, due to the number drop that came out, where a lot of numbers were sort of added in, and then things have gone down again, and gone down even more. I don't know, have we ever been as low as 0.76, which we are?
Oh, no, not at all. This is the lowest we've ever been by far. And as you can see, we've taken back the top spot. I'll darken my screen so everyone can see it.
Yeah.
We've taken back the spot as the best in the country right now as far as our RT estimate. It's 0.76. The range, which is sort of their confidence range at 80%, they're saying this thing is either at a 0.58 to a 0.9. And just so everyone understands what the RT, the R0 is that this is the essentially, what it boils down to is, in Arizona, 100 people that have COVID-19 can transfer it to 76 people, according to this estimate. That is why everything sort of is going down right now, or at least this is why this thing perceives that things are going down, is because it says, look, obviously your transmissions are going down, so we think it's 100 to 76 people.
Yeah, it's the measure of how fast the virus is growing, and it's really good news. We're seeing even more states join us in the green. There's still some concern. We see Hawaii, South Dakota, North Dakota all high on the list. Montana also high on the list at this point.
Yeah, these are states that are relatively late in their infections. They have very small infection rates. South Dakota, Montana, Hawaii, all of them very, very small. So there's still there's not a lot of seroprevalence. Not a lot of if you look at their per capita numbers, they're very low. So there's a lot of room, sadly, but the reality is there's a lot of room for growth in those areas.
Yeah, we will continue to track that. I heard even the governor's office was tweeting out this number today, so they're pleased that some of these mitigation strategies are working here in Arizona. When we talk about some of the hospitalization numbers, overall, Garrett, we are still trending in the right direction. Things are still going down as far as the hospitalization numbers. How about ICU? Because I know we've been watching that a little bit closer, and the emergency rooms a little bit closer. So how are those two things in particular looking as we start this week? And we get these numbers pretty much in real time from the hospital.
Yeah, we'll start out because there was a COVID-like illness update on Sunday. So we're going to start out here. I don't go over this very often. In fact, I only go over it once a week because it only changes on Sundays. So first, we're going to look at the surveillance. This is the CDC's syndronic system. It basically says we're basically looking at all the systems when people input the data for anything that appears to be a COVID-like illness. You can see the red line here is from the emergency department. The gray line is for the inpatient beds. And here we are. Our emergency room department number is lower than we have record for. And then the inpatient number, not quite as low. We're still at around March for the CLI. But this is why basically we've made all of our CLI gating metrics at this point, is that you can see these numbers are so low. So starting with that.
Sorry about that.
It's okay. It's okay.
My phone is linked right into my computer, and apparently someone's calling.
So with that being said, I'll go over the COVID-19 hospitalizations. And again, these are bed counts for anyone that might be concerned about where this data comes from. This comes directly from the hospital systems, and it's gone through a pass-through at the AZDHS, but AZDHS doesn't actually handle or manage this data set. It's just a pass through the hospital systems. So we hit a milestone yesterday on inpatient. You can see it's a little hard to see, but we now have less than 1,000 inpatients in the for COVID-19 in the state. That is something, as you can see, we haven't had since basically. Right here about June 1st was the last time we had that. So we're now back in May for our inpatient, which is essentially where we were obviously when we reopened up. So we'll look at ventilators. Less than 200 ventilators are being utilized by COVID-19 patients right now. The ICU number did go up a little bit. As you can see, it went from 329 to 345. ICU tends to be a lagging indicator, so not too concerned about that as far as watching it, where the infections can go at this point. This is simply probably people staying in the ICU longer that have the disease. Discharges were very low today. Emergency departments did tick up again, but as we can see when we look back at these lines here, we can see that it does tend to tick up and down, tick up and down, and tick up and down, and that we are back to sort of seeing a lowering of this number. So hopefully that continues. And intubations is it's like the third lowest we've had since the very beginning. In fact, I think, which one was it? The ventilators. I forgot to go over that. Ventilators this is the lowest ventilator number that is on this chart, with the exception of April 8th when reporting began. So that's something I forgot to mention. That's a pretty big milestone.
It's a huge milestone because that like you said, when reporting began, when we started tracking this, April 8th, I don't think we've had any metric on here when we're cross-referencing it back to the last time in any of these charts. It's been anything further back than June or May. So to see something, I think specifically in your notes, April 8th.
Yes, April 8th. That's the first day they started reporting COVID-19 metrics, and now our ventilator use is basically it. That's the only day left that this isn't lower than.
Yeah, just really, really incredible news that we'll keep tracking. So, wow, it's positive all around in that case.
Yeah,
Garrett, when you talk about the upticks in a few of those, I believe you mentioned it in, was it the ICU?
Yeah. So there was a small uptick in ICU, but you can see based on this data, we tend to have a small uptick. In fact, it usually appears around the beginning of the month, like the week on the Monday or Tuesday, we have a small uptick. Yeah. That may have something to do with how these are discharged or something, because you can see there's sort of a pattern there in that it goes up and then it starts going down again. Again, I'm not saying that this is going to do that, but basically it's just showing that, we have had upticks before, but they haven't established a trend. We're still going down in the ICU numbers.
Yeah. Amanda writes, thank you for not putting more fear in people. Yay for good numbers. Amanda, thanks for taking the time to leave that comment. That means a lot. That's why we're here, is to talk about these numbers, help people understand them when they are good and bad, encouraging and discouraging. That's all we're here to do, is help you through these numbers. So Amanda, thank you so much for writing that. Garrett, when we look at things overall, when we see this, these cases each day, it's not increasing as fast as it was. I mean, today we're reporting 300 numbers. Last week, I think the highest day was about 500 new cases or so. I mean, we're not seeing these monster days that are like 1,000 new cases, or my gosh, God forbid, like we saw during the height of this, 3,000 new cases a day.
Yeah, I mean, this is, I made it a little easier to see. This is the epi chart for the cases. Epi chart meaning this is the actual date of the positive test, not the date that it's reported on, but the date it actually occurred. And you can see right here, our peak happened on the week of June 28th, so basically the week of July 4th, and it was at 27,807 cases that were affirmed for that week. But you can see this is very precipitous dropping at that point. This is basically almost 10,000 drop, almost another 10,000. I mean, it's essentially a halving in these cases. So we're seeing 30-40% drops in our case numbers every week at this point.
Yeah.
Again, I don't know. It's one of those things where it's hard to tell and forecast where this thing is going to go. Of course, we don't know if we're going to hit a floor soon or if we're going to keep dropping. We just don't know yet.
Either way, it's encouraging. Oh, Sarah, thank you for that nice comment. She wrote, knowledge and understanding is what this is all about. Thank you for doing this. Thank you for the comment, Sarah. We love everybody who's joining us on here who has a keen interest in the numbers as well and how this thing works. And wow, it's fascinating to see how when the state of Arizona puts their mind to something, we're able to turn this thing around. So we see all that red in the center there. But boy, we're able to really pull those numbers back to where they were at the beginning of the summer and really make some positive changes that literally save lives here. I mean, this is literally a difference between life and death.
Yeah, I mean, obviously, it's a dispute on what groups are getting cases, of course, and how this thing spreads. But obviously, it's just when you talk in terms of numbers, the more cases, the more probability that people will die. At least as far as the confirmed numbers that we have, because that's just the way it is.
Garrett, when you can you show everybody where to find the demographics page on the Department of Health site? I think that, it's not a page that we go to every single day on here because a lot of people want to be updated on the schools and the bars and the restaurants and the gyms and sort of the social part of their life. But this age group that you just highlighted right there, we're still hovering at about 12%, right?
Yes, it's stated around, it's been at 12%. They have been, it's kind of interesting. I watched again today that age group did increase at a slightly faster rate than the other age groups. But again, the case numbers are so small at this point that it's not really going to make a dent on the percent of cases. We're talking, I think they grew at a 0.5% and everyone else grew at like a 0.3 or 0.2%. So, and while it's like, well, you can say materially, yes, this age group grew at a faster rate, it's still, it's not like it's growing by leaps and bounds and no one else is growing. It just is growing slightly faster.
Right. And so total, about 24,000? It's hard for everybody to see that.
Yeah, 24,338 cases that are less than 20 years old. And of course, it's important to remember that this is a total of the entire pandemic. And a lot of this group especially, they recover, or at least they stop becoming an active case after about 14 days. So I would say, I haven't actually done the numbers on this yet, but there's probably, if we're looking at about 20,000 or so active cases, there's not a whole lot of that group left that are active cases at this point.
Yeah. Hey, Rick's asking a question. Rick writes, so your opinion, do you think Maricopa numbers will come in line for gyms and bars with food so they can reopen on Friday? Rick, what we can tell you is a lot of the restaurants and gyms and bars have put in an application to be able to get started on their reopening. We've got a whole list right now if you want to peek at it over on abc15.com. And we've had, I believe, at last check, and producer Josh can tell me if I'm wrong on the numbers, but at last check on Friday, we had 1,100 places of business already put their application in. And I'm sorry about this phone. I don't know what's going on today. I've got to set it far from my computer so it doesn't ring into my computer. At this point, I think I'd want to. So Rick, sorry, 1,100 businesses had already put in their application to reopen, and we've been tracking the ones that have opened up. So at close of business on Friday, we were at 1,100, and 95 had already gotten approval. That includes 8 bars, 83 gyms, and 4 theaters. Now, Rick, I can tell you there have been 200 businesses that have been denied. So they've got to go through and write what they attest to do, what their plan is, what their focus is going to be to keep both their clients and their staff safe and try to reapply there. But of those 200 denials, 102 were bars, 97 were gyms, and 1 theater. They said, not enough. So that's where things stand right now. I'm sure you want to see the list. It's over on abc15.com, a complete list of all the places that are making the cut so far, and then we'll continue to track that percentage rating as it comes out for you on Thursday and Friday. Any insight into that, Garrett?
Yeah, what I can tell you is that, and I've got it pulled up if producer Josh wants to pull it up. This is Maricopa.
Josh also just put in the comments the exact link, so you don't have to go hunt over there on abc15.com. That abc15.com/entertainment. It goes on and on and on, a long URL. Click on that, Rick, and you'll be able to find that exact information on there. But as you saw here, Garrett,
yes,
looks like it's getting better.
So this is Maricopa County. It's considered substantial right now, and you can see the reason it's considered substantial is July 26th with a 10.9% test rate and a July 26th for 121 per 100K individuals cases. You can see that what they do is, of course, they reevaluate this graph based on each week as it moves forward. So next week, these will no longer be evaluated for part of this gating. It will then be this week and the week that these is after this week. And we know just by looking at the data that there's unless something changes very drastically over the next 3 or 4 days, Maricopa will be recalculated into the moderate category on Thursday, which does give gyms and fitness centers the ability to apply for a reopening of, I think, 25%.
25, yeah.
Yes.
Yeah. So, of course, Thursday is a big day for all of us on here to kind of update that stuff. And we absolutely will as that information comes out. And we've kind of seen a new trend with the governor talking on Thursdays. It's kind of the more typical day now that he's meeting up with reporters. So we'll see if that's the case as well. If he's
I think that the only business, and please correct me if I'm wrong here, but I believe that the only business that still cannot open, at least based on the gating criteria, is bars and nightclubs that don't serve food are still considered closed, even at moderate spread.
Yeah. Let's see. I just saw a comment from someone a moment ago who, here it is, Emily's writing that her brother is on life support. Just in case you're lucky enough to not know anyone personally get affected, it doesn't mean it doesn't exist. Emily, first of all, our thoughts are with you and your brother and your entire family. So many Arizona families going through this and really seeing firsthand the effects of COVID. I just had a friend lose it's her mom's partner in life, and she lost him. And reading how that has devastated their family this weekend is just crushing to read. So it absolutely does affect people here in Arizona. And there's been 4,771 lives lost. That means 4,771 Arizona families who know this all too well. So we are with you in thought and in heart as we read your comments on there. Garrett, any other things? We had a question earlier about recoveries, and you've sort of provided us a range, an estimate, if you will. There's not a set place to go for an actual ticker number there as to how the recovery's going. We know people are recovering. We know there are also long haulers who have this virus for a very, very long time and are trying to pull through. But in your best estimate, what is our range here in Arizona for active cases when we see that we're approaching almost 200,000 cases across the state since this pandemic began? You subtract out, sadly, those who have succumbed to this, and then subtract out others that have sort of timed out. In what number, and timed out I mean by over 28 days, over 14 days with the virus, so we can kind of figure that they are likely over this, and what number do you get?
It seems right now that it's anywhere from 12,000 to about 30,000 people in Arizona that could be sort of active carriers for this virus right now. So you take that 200,000, but realistically, it's a much lower number because most of those people, as you just said, Katie, are they no longer, if they do have the virus, they're no longer infected, or they're going through the stages of recovery, but they're no longer infectious, not infected, but infectious.
Mm-hmm. Yeah. Lisa's just saying, yeah, why not talk about the recovery rate? That's exactly why we wanted to talk about it right there. There's just not a set process, if you will. So we have to do our best analysis to figure the math for you, to try to help you understand what these numbers look like. All right. Yavapai and Apache counties are the only two counties that have come out and said they meet the metrics for schools. We'll get an update on that specifically on Thursday as well. How do you think things look? Do you think, Garrett, anybody else is going to be able to join Yavapai and Apache in that category?
Yeah, I think that I can go through them one by one here, just by looking at what, where things are. It does appear that a good number of them can make it. Unfortunately, Coconino got knocked out because they went up, so they're going to have to wait at least 2 weeks. I think La Paz is probably going to be there. It appears that Maricopa is going to have to wait a couple weeks. So will Pinal. That will also. I'm going through it right now. Cochise looks like. Nope, not Cochise. Sorry, they're still under it. And it looks like we're not going to have that many changes.
All right.
It's going through this one by one, and it doesn't appear that that any of the counties are going to be, for the schools, of course. This isn't for the businesses. The schools have a specific metric that they have to make a 7% positivity, and a lot of the counties are like within the 7 to 10 range, but they have to be under 7 for 2 consecutive weeks, and most of the counties don't have that quite yet.
Yeah. Let's see. Dawn has been so patient in asking any new cases in Cottonwood. Are we able to get that specific for Cottonwood?
Yeah, let me get to Cottonwood in a second. I do have the Pinal County schools updated, and I just wanted to throw that out there because I know people ask about that.
Yeah.
Pinal doesn't include a map. It's not as fancy as Maricopa County, but it does have metrics for school openings in Pinal County. So we can see, so right now, Maricopa Unified in Pinal County does make moderate status for hybrid opening. J.O. Combs looks like it could make moderate status. Apache Junction could make moderate status next week. Sacaton Elementary, Stanfield Elementary are both within, as far as they're eligible at this point, and that's about it right now. All the others still need to have it. They need to have 2 of these. So you can see most of the others don't have that, where they have 2. So that's where we are. Casa Grande looked like they could have had one, but they didn't make it this last one, so they have to wait another 2 rounds essentially.
And did we put up the site where people can find that particular page? That's the one that was just added out of Pinal County, right?
Yes, I'll pass it off to producer Josh so he can put it in the comments.
Okay, we'll make sure if any of you are looking for that you can. Oh, yep, you added it in the comments there, so we'll be able to put it up there. Yavapai doesn't have something like that, I don't think. Brant was
not that I know of right now. I can look right now. I can tell you that Cottonwood has had 265 cases throughout the entire pandemic, but I don't have that parsed out, so I don't know what's active and what's not active in Yavapai right now. But it's about 265. It's the 3rd highest in Yavapai. Prescott being the highest. Prescott Valley being the highest, followed by Prescott, and then Cottonwood.
Yeah, perfect. And then, was there specific information on Cottonwood on that page for Dawn?
No, it just says 265 cases for Cottonwood. It doesn't say anything else. And again, I don't have any of the cities parsed out in Yavapai, and I haven't seen anything yet as far as them doing any sort of like GIS mapping or any sort of gating with everything. I'm still looking for that, but I haven't seen it yet.
Okay, perfect. Anything else you want to get to? Boy, we're already cruising through the afternoon here and going to be running out of time shortly. But and Brant says thank you. Brant, you're welcome. Thanks for joining us on here. We hope your kids are doing good. Let's see. Overall, we've had 5.7 million cases here in the U.S., 177,000 deaths, just to update those of you who aren't tracking them across the U.S. Globally now, 23.5 million, 810,000 deaths. So that just kind of puts it in perspective with what a large percentage we have right here in the U.S. Compared to globally.
Yeah, well, let's just go over a couple small things here and there because it's Monday, and I just want to update everybody on where things are. So we'll go over the modeling really quick using the model I like, the machine learning model. So you see where we are, at least where it thinks we are. And again, these don't consider, these don't typically consider the actual confirmed numbers as far as its projections are concerned. It does believe, well, this one does, the deaths do, and it does believe the upper range, where it thinks that by October 31st, we'll have about 6,527 confirmed deaths, anywhere from 7,800 to 5,610 in that. You can see the RT estimate here is a little higher. The RT Live says 0.7, I think it was 7.6. This one says we're at 0.89. This is where things this is not the confirmed cases. And you can see right here, it believes that we're pretty much we're coming to the end of our curve now and it's saying that newly infected people in Arizona, it thinks about a little over 9,000 people have been infected in Arizona today. And again, these are COVID. These are not confirmed cases. This is all modeling. You can see it perceives that about 160,000 people in Arizona are walking around with the virus, and that 1.6 million or so, a little under 1.7 million, have had the virus since the beginning.
So, Garrett, you like this site best because it's machine learning. It doesn't have as many variables in it from.
Yeah, it's much more. You can't. The thing with machine learning models is that you can't really play with the variables too much. You have to pretty much keep it one way. Mm-hmm. And this one has been very accurate in the way it's consuming data from all over the country and all over the world and making the best estimates it can. And because it's not allowing the model makers to sort of play with the data as much. To me, it's the most accurate because it's the most conservative as far as in its estimates, as far as what you can change and what you can't change.
And for people that are unfamiliar with the site who are just looking at it from home, so the shaded in area is sort of the range of yes. where they think it could possibly lie, with a high degree of certainty that it's where that line is.
Yes, and it's been very accurate in other places in the country. So I don't have any belief. I don't have any reason to not sort of to take this with too much of a grain of salt. I think that this is a pretty good one. So
Kathy's asking if we can kind of slide that bar forward and see how things are doing in, say, December, November, later in the year. How do things look?
Yeah, I mean, when we're at the all we can do is October 31st. Sorry, that's all. That's all they give us. They give us about 90 days of projections. This will go to November 30th, probably in September. This will move to that time period, but they always just give us 90 days. So this is what it's basically saying. It's saying total infection in Arizona, 28% of Arizonans it perceives to have been infected by this virus by October 31st. And right now, while that sounds like a lot, it thinks that right now we're at 23%. So it thinks an additional 7% of Arizona is going to be infected. Excuse me, not 7%. I was thinking 30%. 5% of Arizona is going to be infected in the next 90 days.
Wow, interesting. All right, and what else does this site give us? There's a few other sort of predictions, if you will. Was that the bottom of the page?
Yeah, that was the bottom of the page. It does give us, it looks like it does Maricopa now. this is brand new. It hasn't done counties. So this is the first time I've seen this. So it does give us some counties here, which is great. It does think the RT is a little higher in Maricopa County. It thinks about 4113 deaths projected by November 1st in Maricopa. As far as the number of currently infected, 139,000 in the county. Newly infected, about 8,000. And then the total infected in the county, about 1.2 million.
Yeah. Kathy writes, thank you. She said that she's just concerned about the election turnout. Yeah, keeping everybody safe during the election is obviously paramount, and how to go about doing that. So that, you know, and that's just not about the voters. That's about people who are volunteering to run the polling sites as well. So it's about keeping everybody safe. So we'll continue to watch that. Was there any modeling that was going out further that you saw, Garrett? We don't necessarily have to go to all of them today, but were there any that INHE or any of those modeling sites that gave us numbers far out, maybe as December or?
I'm looking at IHME right now because it's the other one. I don't know if they do that. A lot of sort of epidemiological models. Oh wait, look, it looks like IHME does go out to December. So let me bring this one up too, just so we can see this. This is the University of Washington model. This one has been kind of touch and go. It's probably better now because it's had so much data to be consumed into it, but it was very touch and go early on. This one brings us all the way out so we can see total deaths in December. And this one thinks current projections about 9,500 with its mitigate with what we're doing right now. It believes that that's not going to change much with mandates easing, and it believes it would be much lower with universal masks. As you can see with daily deaths, it does think it's going to stay about where it is right now. And then daily infections, it says right now we're at this 4,100. Usually when you have a mitigation strategy part of your model, you can see when you have mandates easing. This is one of the reasons I like the COVID projections model, because it doesn't have these sort of these pathways. Because you can see this one presumes that if mandates ease, we're going to be at 30,000 daily infections in December 1st. So it has a much higher curve. So and not that it's just there's a lot more questions to that. You know what I mean?
Yeah. Yeah, that's interesting that one stays so low and one really takes off again. What is that point in the graph where it's hard to see what that data is? Right
here?
Yeah.
This divergence looks like this is what is that? That seems to be at current. So this is current projections. For some reason, I've never seen this where it diverges like that. It assumes in November for some reason it's just going to flip down.
Well, what about the top? Is that where it says masks and?
Yeah, this is basically, you can sort of look at these and say, okay, I want to take this with masks. I want to take it without masks. Basically to sort of get an idea of what when mitigation strategies change, you know, what could change about the models.
Yeah, that's really interesting to share that. That one does not break out to Maricopa County, though. The best we have.
I don't think so. No, I don't think so.
Really interesting. I know they were updating that like Tuesdays and Saturdays. What's the most recent update date for that particular IMHE model?
Last updated August 21st.
August 21st. All right. Worth noting, and we'll keep tracking those. We're sort of running out of time already, but wanted to get to some of those models. Really helpful to just sort of look at where things stand and where they predict that we'll be going. We want to thank all of you for joining us on here. Really good conversation as always. You can find Garrett at Garrett_Archer. That is his Twitter account. You've continued to update us even over the weekends while people are relaxing and enjoying their weekend. You're still able to keep us updated on that. So we very much appreciate that. So we know how we're doing here in Arizona. You can find me on Twitter as well. Boy, I've been so busy. I've been neglecting my Twitter account. I'll get back over there, I promise. At Katie Raml is my Twitter account. And so many names I'm seeing here in the comments are also joining me over on Facebook. And I appreciate that. At Facebook.com/news from Katie. Kathy, thank you. Oh, she's going to be listening tonight. Thank you, Kathy. And that reminds me, our very latest newscasts are happening at 4, 5, 6, and 10 p.m. We've got our crews spread out all over the valley. A ton of information coming in on this Monday, and we'll break it all down for you. We'll have more information on what's going on at U of A and also these crackdowns that are happening from Tempe PD to the community there. We'll keep you updated on that and all the happenings of the day. Of course, if you missed any of our information, you can find it at abc15.com/coronavirus. And we'll see you back here same time, same place tomorrow.